When choosing a medical plan, you sometimes have the choice of picking between an HMO, PPO, or HDHP plan. Let's talk about what these letters mean and the key differences in these types of plans. First, an HMO, or Health Maintenance Organization, is an insurance plan that may offer lower monthly premiums, the cost for the insurance, but also gives you fewer choices regarding where you can receive care. The insurance provider has a list of approved doctors for you to choose from to receive coverage, meaning there are some doctors you cannot visit using your HMO plan. With an HMO, you must designate a primary care physician, or PCP. Think of your PCP as the main doctor you visit for routine medical care. With most HMOs, you must first visit your PCP and get a referral to see any specialists you may need to visit. And with an HMO, every time you see your primary care physician or a specialist, you pay a predetermined flat amount called a copay, no matter how many times you visit. A PPO, or Preferred Provider Organization, is a plan that gives you more freedom to choose from a larger pool of providers, but generally comes at a higher monthly cost. While the network is larger in a PPO, there are still providers that don't fit in. You can choose these out-of-network providers and get some coverage, however, you usually end up paying more for those services. PPOs do not require a primary care physician, therefore eliminating the need for referrals and giving you the ability to go directly to a specialist. Finally, an HDHP, or High Deductible Health Plan, is a different type of plan altogether, aimed at giving you the most control over your health expenses. HDHP medical plans typically offer the least expensive monthly cost for coverage, but require you to pay all of your healthcare costs that are incurred until you meet the deductible that is listed on the plan. These plans keep your costs low if you don't utilize it a lot, but keep you financially protected in cases of catastrophic illness or emergency. HDHPs are similar in structure to a typical car insurance policy. For example, if Bob's Auto says it will cost $5,000 to fix your car after an accident, and you have a $2,000 deductible on your auto policy, you will be required to pay $2,000 and the insurance company will pay the remaining $3,000. The higher the deductible you choose for your medical plan, the smaller the monthly cost will be. But it also means when you have health expenses, you are responsible for all the costs up to that deductible amount. Generally, HDHPs use what is called coinsurance to determine how much you pay for services after you meet your deductible. This is the percentage of a bill that the insurance company will pay at that time. For example, after hitting your deductible, if you get a medical bill for $1,000 and your plan has a coinsurance benefit of 80%, the insurance company will pay $800 and you must pay $200. The coinsurance eventually stops and the insurance company starts to pay for 100% of all healthcare expenses when you have personally spent the amount listed as the out-of-pocket maximum on the summary of benefits for your HDHP plan. To sum it up, HMOs offer lower monthly premiums but limit the choices you have for doctors. PPOs offer more choices for doctors but typically cost more on a monthly basis. And HDHPs provide the most flexibility for you to manage your healthcare costs, typically offering the lowest monthly premium, but requiring you to reach a deductible before benefits become effective. And now you know the differences. May your newfound benefits knowledge guide you until next time.